Hi, YouTube family. This is your pharmacist, and welcome to my YouTube channel. Today, the topic we'll discuss is diabetes. So, now let's see what is diabetes. Diabetes एक autoimmune disorder है और diabetes is just your elevated blood glucose that can damage your nerve tissue and your blood vessels. It is also called juvenile diabetes and it is characterized into three types: type 1, type 2, and the third one is gestational diabetes. Today we'll discuss type 1 diabetes. It is called juvenile diabetes, and about 5% of population is affected by type 1 diabetes. So how you see how it works? You have islet cells in your pancreas. These islet cells are destroyed by your autoimmune system because your autoimmune system take it as an invader and it destroys it. If it is too much, then it can elevate your blood glucose level and it can cause hyperglycemia. And there is a condition in which there is ketoacidosis. In ketoacidosis, your body uses ketones, and it is a very threatening and a complication situation in which you need to be treated first. So I told you that there is a beta cells, there is insulin, there is glucose that need to be into your blood cells. But when it is not in your blood cells, it is in your bloodstream, and elevated level can damage your nerve tissue, can damage your blood vessels, and it is due to autoimmune disorder. Your immune system take these cells as an foreign object, as an invader, and it starts destroying it. When your islet cells are not working properly, they are not going inside your blood cell, it means there is a need to see your practitioner, your doctor. But how you would see that? There are some symptoms for type 1 diabetes. Now let's discuss the symptoms of type 1 diabetes. So let's just get through it. That it is an autoimmune disorder, and your immune system mistakenly treats the beta cells in your pancreas that create insulin as foreign invaders and destroys them. When these enough beta cells are destroyed, your pancreas cannot make insulin because it is the duty of your pancreas to make insulin. So the patients who are suffering from type 1 diabetes, they need to take insulin. They have to administer insulin because they cannot live without it. And insulin is a hormone that helps blood glucose to enter into your blood cells and can be used as an energy. If you have diabetes and your blood glucose cannot enter your cells, so it builds up in your bloodstream, and this causes elevated blood glucose, which is hyperglycemia. And over the times, it causes many complications, and it is relevant to diabetes related complications. For example, cardiovascular, chronic kidney disease, eye complications, neuropathy, ear related disorders. There are many disorders that are related to diabetes. So people say that it can happen only to young people, but it can happen to anyone at any time. And you must consider the symptoms that are relevant to diabetes. For example, you are urinating event, you have thirst feelings, you're feeling very hungry even though you are eating much enough, and you have extreme fatigue, and you have blurry vision, and when you get a cut or a bruise, it takes time to heal, and you are weighing too much less, like you weigh less, you weigh is um, is decreased even though you're eating enough. So it is important to know the symptoms of type 1 diabetes. And in my very next lecture, we'll discuss the treatment, and we'll discuss the complications that are related to type 1 diabetes. And then we'll discuss type 2 diabetes, and then so on, we'll discuss the gestational diabetes. So if you have revised something from me, and if you liked my video, then I would suggest you to please like, subscribe my channel. And this would mean so much to me, and this would motivate me to make more videos like these. Um Thank you so much for listening to me and for bearing with me. Thank you so much. Have a good day. Bye. Different class contain beta cells and